One of the things that's happened, I think that's hurt us in this country in terms of pharmaceuticals, we have so many warnings about what the possible side effects are that we start to lose track of it.
We tune out.
That's right. And the best evidence of that, boy, I'll tell you, Marissa, is that we are one of only 2 countries on the planet, the other being New Zealand, that allow direct-to-consumer advertising. You turn on the TV, you see an ad for pharma. People come here from France or Italy or that, they're horrified. They say, what? Is that a joke? No, it's true. We allowed it in 87. And as a result, pharma advertises to us, the consumer, even though we can't prescribe the drug. It's odd business. The doctors have to prescribe it, but they want us, the consumer, to go to the doctors and ask for it. To say, hey, I just saw a great new ad for migraines. I suffer from migraines. How about giving me that? Yeah. And in the billions of dollars they spend, the law says this: they don't have to give you the side effects on a television ad if they don't tell you what the drug's for. So the first TV ads they did, I know that sounds odd, how could they then have the drug, were for Claritin, an allergy medication. I remember the first time I saw it was a couple running through a field of flowers. I thought for an antidepressant was for allergy instead. It doesn't tell you what the drug is for. But if they tell you what the drug's for, then they have to have somebody at the end of the ad running through very quickly what the side effects are, always ending with possible death. And they found out that in these little sessions that they do, that they have with consumers, where they show them the ads before they put them on, in focus groups, they tune out these side effects. They listen to them, and then they say, now, what were the side effects on that drug? And they say, well,
they also say them at the speed of light. It's faster than Ben Shapiro. It's impossible to hear it.
It is at Ben Shapiro speed. That's exactly right. And there's no black label or anything else given there. And so they've learned how to give so much information in a short amount of time that it doesn't dissuade people from taking the drug. All you focus on, if you're the consumer, is the part that says, oh, by the way, breakthrough drug on X, Y, or Z. Mm-hmm. And how do we end up taking drugs 9 times out of 10? If a doctor doesn't prescribe it to us, people hear about a drug and then they want to know more about it. What's that weight loss drug I heard about? And
they put the pressure on the doctor.
Yeah, I've heard that. There are very few doctors, what I call very strict prescribers, because some doctors used to say, no, that's not for you. And now they know that if they don't do it, guess what? Since telehealth has been approved by the federal government for Medicare paying telehealth, and now many private insurance companies pay for telehealth as well, you can do a Google search and found Ozempic, for instance, prescriber, or Xanax prescriber or whatever, and you'll come up with a mental health or a weight loss clinic that has a doctor or a nurse practitioner online who will then have you fill in a questionnaire. And if you've done a Google search, you'll know what answers to give, and you'll get a prescription for that. So if your own doctor doesn't do it, they're afraid of losing you as a patient as well.
Right.